Good morning, everyone. It is 8:01 a.m. on June 24th, 2025. I will call the June 2025 Board of Health meeting to order. My name is Deanna Diamore, Director of Health. Present, we have board members Frank Ehrlich, Norman Weinberger, Joan McNeil, Janet Karpiak, and Anthony Santella. We also have staff members Aniela Fignon, Teresa Argandesi, and Brian Weeks present. The next item on the agenda is public participation. I see we have Ms. Diane Lauricella with her hand raised. Ms. Lauricella, you have 3 minutes, and please speak about an item on the agenda. Good morning.
Good morning, Diane Lauricella, 21 Little Fox Lane. Over the years, I have spoken as a waste management professional, also a former regulator in toxic hazardous waste, and also a concerned resident about issues that relate to public health. Today on your agenda, you have both the epidemiological report and, of course, the medical director review that will be held in executive session. So I'm going to combine the two of them and just make general comments for your thoughtfulness during that deliberation. Previous medical director under the during Tim Callahan's reign as health director, seemed to be someone that hardly anyone in the city knew about. So I'm hoping that from whoever the medical director that you are selecting, I would love you to ask them what is their view of what it takes to be a public health department, as to whether the public has the right to know about toxins and broader environmental issues that affect their health. Some examples I'll give includes something that I have requested a meeting with this health director related to artificial turf fields. There is science, including Mount Sinai with Children's Health, that talks about the imminent dangers related to certain use of artificial turf. We had 7 in Norwalk. Now we have 6 because of the Norwalk High School build. I didn't hear one peep from this board, which is an important board in our city, about some of the possible problems of young children playing on this plastic grass. And it is well known that there are risks. Also, as a former industrial power, Norwalk still has the legacy of chemicals in the ground and in the groundwater, both in our former landfill and in various sites around town. I have yet to see this health department take much interest, if any, in assisting in making sure the public has the right to know, and also to keep the mayor's office and the council apprised of any issues. Even though the traditional health department that I've seen here in the 45 years I've lived in Norwalk is given reports, and I don't expect the sanitarians to be totally experts in toxics, this department has the right to make and hire experts to help advise the laymen who are on our boards, commissions, and the council and the Board of Ed. So I would like you to think about this when you are selecting a medical director. Lastly, my experience with this board and the staff related to COVID and creative ways to spread the word about the use of the right kinds of masks fell on deaf ears. There were some changes made, and I appreciate them. But going forward, because we know there will be pandemics or nearly pandemics, please make sure this medical director will support the staff to go wider, to go broader, to be more creative, and not hide some of the facts that will help our people stay healthy in the light of climate change and the heat dome that we are in today. It only makes the toxins issue worse. And lastly, I hope your medical director will make sure that this mayor does not cut the funds for a full-time lead inspector. A city of this age with its main houses built before 1978, there is no reason why we cannot be more proactive in keeping our children from lead paint poisoning. We should not use them as canaries in the coal mine and wait until them getting their blood tested. We should be out there right up front, and each of you, I hope you will make sure this staff, this director, and this medical director you're about to select, make sure you are truly a public agency and not operating the way it has been on the subject of toxics. There are many other things this board and the staff do that are terrific, but on the issue of environmental toxins, this board and this staff and this city has yet to meet the moment. Thank you very much for listening.
Thank you, Ms. Laura Cella. I don't believe we have anybody else from the public to speak, so I will close public participation. The next item, let me just note that David Reed, who is our current medical director, has joined, as well as Darlene Hoffler is our supervisor of clinical services. The next item on the agenda is acceptance of the minutes of the regular meeting of May 27, 2025. Do I have a motion to approve? Anthony, and I think a second was Joan. Do we have any comments or edits, suggestions for the minutes?
No.
Hearing none, I'll call for a vote. All those in favor of approving the minutes, say
Aye.
All right, I believe that's unanimous. Jana, is that a yes?
That's a yes.
Okay, thank you. All right, they passed. Thank you very much. All right, so I have the director's report, and I just have a few quick highlights. I wanted to share that Aniela Fignon, Catalina Mosquera, and I will be presenting an on-demand presentation for the National Association of County and City Health Officials, their annual conference. We've been selected to share one of our presentations in an on-demand setting. So we're going to be focusing on workforce development and how we've created a supportive work environment. So we're excited to share that with the different health officials across the country and really highlight the work being done here. So I want to thank the two of them for all their really hard work on that, and excited to share some of the tools and the assessments that we put in place to make improvements here. I also wanted to share that we heard good news about our public health preparedness funding. That was one of the areas that is under review at the federal government, but we've been assured that we should be having that funding for at least another year. And that funding supports our part-time preparedness coordinator and our part-time emergency response team volunteer coordinator. And as all you know, that work is really pivotal, and we would not have been able to do nearly, as much as we did during the pandemic without all our amazing volunteers. And then I also wanted to share that, we had our staff, the community health team, hosted a flu planning meeting after our last board meeting where we talked further about, the quality improvement project and the results and how we want to plan for next year and for our clinics. And we talked about some of the messaging and the ideas that the board put together at our last meeting, and the staff was really receptive to it. So that work continues. We're going to be planning, but we want to do even more communication and messaging related to flu for the flu season and flu vaccination. And then I know we have our epidemiology updates and our community health updates. So I just wanted to, as you all saw on the agenda, we have our medical director appointment discussion during an executive session. So we'll be going into executive session later on in the meeting, and then we'll come back at the end to conclude the meeting. So I just wanted to share that as well. All right, I'm going to pass it on to you, Brian, to give epidemiology updates. Good morning.
Hey, good morning, Deanna. Good morning, board. Good morning, everybody. So I'm going to fly through this real quick, just to be effective with time and efficient with time. Alrighty. So what you guys have seen is the CDC respiratory illness activity for Connecticut. As you can see, it's very low. The thing I just wanted to hit home for wastewater viral activity, it has jumped up for COVID-19 to moderate. And the reason for that, it's driven by, as we were talking about in the past meeting, the NB181, or called Nimbus now, that's nickname now, that's growing in terms of incidence and prevalence. And so it's almost about a little bit over a third in competition with LP81, which is what we were dealing with more of the season. But this is, again, a small fragment that are actually sequenced in terms of these specimens. So again, it's probably larger in terms of this incidence, but long and short of it, we're dealing with Nimbus, and that's what's kind of driving the current activity. Keep in mind, we have other things that are driving it too. So we do have even parainfluenza, human metapneumovirus, and then, what's been kind of showing up since, really the springtime, enteroviruses and rhinoviruses, rhinoviruses causing the common cold. But that is happening still, even as better weather. A reminder too, in terms of that mixture, we also have allergies, kind of allergens circulating too. And so we're kind of at a medium level. That's including grasses, plantains, dock, and sorrel. And so if anybody knows they have allergies to this, just keep in mind that you're also going to be contending with that. Then switching gears, just as a reminder, we're still dealing with measles cases as they trickle in. Fortunately, the activity is not as high as it was before earlier in the year, but still the number is, at 1,214 now, based upon the CDC surveillance, which will be updated on Friday. Keep in mind, too, that, for 2019, which was a very high year for measles, which stopped suddenly because of the pandemic and all the other prevention measures, we got to 1,274. So we're only about 60 measles cases for 2025 away from getting to the same level as 2019. So just to give some perspective there too. Again, just a reminder in terms of the prevention, the best thing is the vaccine, getting those 2 doses. And, just being wary of it too, especially somebody's more susceptible in terms of immunocompromised or immunosuppressed state. So we have great resources here at the Norwalk Health Department that one can reference. And then switching gears once more, looking at kind of the environmental side of things, looking at the weather, definitely we're in a heat wave, as we're all well aware, depending on what your resource has been, whether it's the city itself or the Weather Channel or some other weather resource. As you know, today is pretty much going up to 100 degrees. This is the peak of the heat wave here in Norwalk. You can see in the afternoon, that's where it gets to about the 99 or 100 degrees. Currently, it's feeling like 90 degrees in terms of temperature. And then just looking at what the forecast is, Wednesday's 95, then it drops down to 75 on Thursday and 71 on Friday, but then back to 82 on Saturday with a lot of moisture too, with rain and thunderstorms. So, just a reminder, this is the city's release about this, and along with activating the cooling centers that the mayor has done. So just a reminder what those cooling centers are. That is the Norwalk Police Department, the community room, which is 24 hours, the Norwalk Library, main branch at 1 Belden Ave with selected hours, and then the South Norwalk Library branch at 10 Washington Street with selected hours as outlined here on the screen. And then just a reminder too, with extreme heat and hotter weather, air quality does get impacted, and we have to kind of also monitor the impacts from the Canadian wildfires. So just a reminder about that. Pulling up the air quality hub for Norwalk. We're currently at 64 air quality index, which puts us at moderate or yellow. It's driven primarily by particulate matter 2.5. And as you can see for the recent week, we've been juggling around with, kind of in good levels or at moderate levels. So again, that's at the second stage relative to air quality. So it might have some impacts for some individuals, especially those more sensitive, but definitely that happens more with the orange level. This varies throughout the day, so definitely keeping an eye and monitoring that. So that is my overview. Thank you, everybody. Have a great rest of the day.
So much, Brian. Does anybody have any questions or comments for Brian related to EPI updates? All right. Thank you. Thank you again, Brian, for always a great update. I'm going to pass it on to Teresa Argandesi to give the community health updates.
Good morning, everybody. I'm going to share some slides to keep me on track, but I promise this will be pretty brief. I just wanted to share just a few of the seasonal things that the community health team has going on right now. There we go. And so in addition to amplifying messaging about heat safety that Brian has mentioned, we do have some additional things that kind of kick off in May and June that I just wanted to let the board know about. So here are a few of those things. All right, so first of all, we have summer meals. So you may be familiar with the Norwalk Public Schools program to feed children over the summer. Food insecurity is increasing in Norwalk and in many places around the country. And so we really, we don't operate this program, Norwalk Public Schools does, but we really, our Norwalk Food Alliance with all of our food providers really felt it was important to get the word out, to amplify the messaging, and create some materials to help Norwalk Public Schools get the word out about this. So for anyone 18 and younger, they can come to any of these 10 public sites throughout the city for a breakfast and a lunch every day, Monday through Thursday, during the dates that it's operating. The first site opened on Monday. That's yesterday. Boy, that feels like a long time ago, but it was just yesterday. And then most of the other sites begin next week. So we have information in e-newsletters for folks. We're on a press release. We've been circulating this flyer for a few weeks now, and obviously posting on social media to let people know. So you don't have to sign up. You don't have to be a child at the school where the feeding site is located. You don't even have to be a Norwalk resident. Just show up. If you're 18 and under, the meal has to be eaten on site, but other than that, you can get free meals this summer. So something for folks to be aware of. Also, our Norwalker program has a fun new initiative. We're partnering with our friends at the Norwalk River Valley Trail to get the word out about the NRVT and bring people to it to go for a walk. And so we have several dates lined up throughout the June and July. Currently, so these are Mondays, and currently the walks begin at 10 a.m. They're toying with the idea of maybe changing the time a little bit, maybe doing some walks in the evening, so you can stay tuned to our website and social media for that. But in the meantime, we're really grateful to our NRVT partners to help us get Norwalkers out onto the trail. School physicals and vaccines, right? So school is just ending. So why are we talking about school physicals? For many of you, you're aware, kindergarten registration is open. And so we're really encouraging families with kindergartners or entering kindergartners or any of the other families that require physicals. So if you're new to the district, 6th graders and 9th graders before they finish up their year, do need to have school physicals. And also we're encouraging people to get up to date on their vaccinations. So we're still trying to make up a little bit of ground from COVID years where vaccinations may have gotten delayed. And so we're encouraging families to call their pediatrician now, right? Don't wait till August. Don't wait till a couple weeks before school starts. Call now to make that appointment. And so we're really grateful to our partners here listed on this flyer: Human Services Council, Norwalk Community Health Center, and Community Health Centers, Inc. They all are open to new and existing patients, and the community capacity around school physicals over the summer has increased dramatically in the last couple of years. So we're really grateful to these partners who have the ability to counsel patients and get appointments in over the summer. Summertime is also a great time for farmers markets. So we're encouraging folks to visit the 5 farmers markets we have listed here in Norwalk. And so again, the health department doesn't operate any farmers markets. We don't run them per se, but we are working with our food partners to try to gather all the information about the existing markets in the community and let people know about them, so that if they're looking to get some locally grown produce and other yummy goodies, they can stop by any of these markets in town. We have our Growing Gardens, Growing Health program. It kicked off last week with our cohort over at Fodor Farm. We have more than a dozen families signed up. If you're familiar with the program, we bring families with children in Norwalk Public Schools to Fodor Farm over on Flax Hill Road. and the families get, including the kids, get gardening instruction, nutrition education, cooking demonstrations. It's a really interactive and fun way for families to increase access to healthy foods by growing it themselves, but also for the kiddos to get a little bit more involved. There's a lot of research that shows the more involved and connected kids are to their fruits and vegetables, the more likely they are to try them and to eat them. And then finally, summertime is also the time of year for lots of fun bugs. And so we are trying to work throughout the summer to get the word out about protection measures to avoid ticks and mosquitoes. We have this video in English and Spanish on our YouTube channel. We have been posting information on social media and bringing flyers and infographics to all of our community events and trying to get the word out that way as well. But it's just one of those things that we, keep reminding people throughout the summer. Along with summer fun, there are some summer pests as well. So we're trying to work to help people keep that in mind as they're out there having a good time this summer. And that's my update.
Thank you so much, Teresa. Also a really great update and really exciting work that you and the team, the rest of the department are doing and promoting and helping to coordinate. Does anybody have any questions or anything to comment on related to all those updates? All right. So hearing none, we are gonna move on. Thanks, Teresa. We're gonna move on to the executive session. So we have to vote to, make a motion and vote to go into the executive session. And if we vote to go into executive session, then we will leave this meeting and Yella will keep the main meeting going. We'll click on the link that I had sent to you all, to the board members. And then we'll have our discussion and then we will then come back to this meeting afterwards to then have the formal vote if you decide to have the vote. And then we will, adjourn from the public meeting and then we will, yeah, I think that's the logistics of it. Does anybody have any questions about that before we make a motion?
So moved.
Okay, Norman, a second. Right. All right. So Norman makes a motion to move into executive session to discuss the medical director appointment, and Frank has seconded it. All those in favor say aye.
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 Okay, great. So we will move. Give me a second to start the other meeting, but I'll see you there in a minute. All right. Thank you, everybody.
Good morning, everyone. It is 8:47. Sorry, I'm just counting. 1, 2, 3. I think we are back. I don't know if Janet had to leave, but the executive session ended at 8:46, and during that time, no formal votes were taken. And so now I am going to ask for a motion to appoint Dr. Catherine Golar to be our new medical director. Do I have a motion?
So moved.
Frank, and I believe Norman was the second. Is there any discussion? All right.
We're
All
lucky
those
to have her.
Thanks, David.
Yeah.
All those in favor say aye.
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 Any opposed? Any abstentions? All right, the motion passes unanimously. Thank you so much, everybody. I'm really looking forward to having Dr. Golar join the team. She's going to bring a lot to the department and to the community. And again, just want to thank David for all your years of service, Dr. Reed for all your years of service to the community and to this department. And thank you again for helping us with this transition and staying on for us to make it smooth. So thank you.
I'm like an old soldier, I don't go away. All this time. Thanks. Bye-bye, everyone.
All right, we are going to adjourn at 8:48. Thank you, everybody. Have a great day.
Okay, thank you.